Okay, so today we will complete the last three topics that are remaining under anxiety disorders. So we will cover GAD, which is Generalized Anxiety Disorder, Substance Medication Induced Anxiety Disorder, and Anxiety Disorders due to another medical condition. We will start with the disclaimer. DSM-5 is a clinical tool. It is intended to be used by trained professionals. क्या कहते हैं, सेल्फ डायग्नोस या एक दूसरे को डायग्नोस करने के लिए नहीं यूज करना. इट कैन लीड टू मिसअंडरस्टैंडिंग एंड हार्म. अगर सिम्टम्स लगे तुम्हें मैच हो रहे हैं तो लाइसेंस प्रोफेशनल के पास जाके डायग्नोस करवाओ. नेक्स्ट वी विल स्टार्ट विद जनरलाइज्ड एंजाइटी डिसऑर्डर. इट इज डिफाइंड एज एन एक्सेसिव एंजाइटी और वरी अबाउट सेवरल इवेंट्स और एक्टिविटीज फॉर मोस्ट डेज ड्यूरिंग एटलीस्ट 6 month पीरियड. अनलाइक दूसरे एंजाइटी डिसऑर्डर्स जिसमें एंजाइटी का स्केल थोड़ा ब्रॉडर होता है, जनरलाइज एंजाइटी में कोई भी इवेंट्स या एक्टिविटीज तुम्हारी एंजाइटी या पैनिक स्पाइक कर सकते हैं. द मेन चीज इज द वरी इज डिफिकल्ट टू कंट्रोल, विच मीन्स कि तुम्हारी ओवर थिंकिंग, तुम्हें पता है तुम कर रहे हो, तुम्हें पैनिक हो रहा है, बट यू वॉन्ट बी एबल टू कंट्रोल इट. द डिस्ट्रेस और इम्पेयरमेंट शुड बी क्लिनिकली सिग्निफिकेंट, यानी कि इतनी होनी चाहिए जो सिचुएशन को जस्टिफाई नहीं कर रही है उतना पैनिक करना. इन अडल्ट्स यू नीड at least three symptoms to diagnose a person with GAD, and in children you just need one. These symptoms are restlessness, fatigue, difficulty concentrating, irritability, muscle tension, या sleep disturbance. In order to diagnose a person with GAD, you need to make sure that it is not due to the anxiety cause, it is not due to substance or another medical condition. It is not better explained by another medical disorder. Development and course, many report lifelong anxiety, although the average onset is 35 years, which is later than other anxiety disorders. We have seen that जिनको भी GAD diagnosed होता है from their young ages, उनमें anxiety present होती है. It is which is usually labeled as an anxious temperament. It has a chronic course with fluctuating intensity. तो anxiety आती जाती रहती है, बट लो रेट्स ऑफ फुल रिमिशन होते हैं इसमें. मतलब सारे सिम्टम्स तुम्हारे बहुत रेयर केसेस में जाते हैं. इफ इट्स अर्ली ऑनसेट, अगर GAD 35 ईयर्स से पहले आया है तो हाई रिस्क ऑफ कोमोर्बिडिटी और इम्पेयरमेंट होगा. वरी कंटेंट शिफ्ट्स विद एज बट एक्सप्रेशन स्टेज कांस्टेंट, व्हिच बेसिकली मींस कि डिफरेंट एज ग्रुप्स में अलग चीजों की वजह से एंजाइटी होती है. It's seen that बच्चों में जो मेजर रीजंस होते हैं एंजाइटी के, इट इज स्कूल परफॉर्मेंस, पंक्चुअलिटी, कैटास्ट्रोफिक इवेंट्स विच इज बेसिकली हरिकेन्स और अर्थक्वेक्स. दे आर वेरी परफेक्शनिस्ट और उनको कांस्टेंट रीअश्योरेंस चाहिए होती है. इन ओल्डर अडल्ट्स वरीज अबाउट फिजिकल हेल्थ, सेफ्टी ऑफ फॉलिंग, ज्यादा हेल्थ की तरफ कंसर्न्स होते हैं और एंजाइटी उस वजह से तुम्हारी स्पाइक होती है. रिस्क और प्रोग्नोस्टिक फैक्टर्स, तीन मेजर चीजें हैं जो कि अब तक हर एंजाइटी डिसऑर्डर में आए हैं. That is temperamental, environmental, or genetic. Temperament is your innate quality to feel emotions, और इसके अंदर traits like behavioral inhibition, neuroticism, harm avoidance, reward dependency और threat biases आते हैं. The two new terms that we are seeing here are reward dependency और threat bias. Reward dependency is पीपल जो कि अपने सोशल सर्कल्स में बहुत ज्यादा डिपेंडेंट होते हैं, उनको अप्रूवल बहुत ज्यादा चाहिए होता है. दे रिक्वायर कांस्टेंट अश्योरेंस. थ्रेट बायसेस इज बेसिकली लोग जो ज्यादा नेगेटिव चीजों में फोकस करते हैं. लाइक अगर तुम लोग बाहर जा रहे हो एंड यू डोंट पिक अप योर कॉल्स, फैमिली तुम्हें कॉल कर रही है, तुम्हारे पेरेंट्स कॉल कर रहे हैं, तुम कॉल नहीं उठा रहे हो, तो योर पेरेंट्स विल जंप अप स्ट्रेट इनटू कि कुछ हो तो नहीं किया, कि कुछ क्या कहते हैं हार्म तो नहीं आ गया. That in most basic sense is threat bias. बस जिन लोगों को GAD होता है उनमें ये बहुत ज्यादा होता है. Environmentally, childhood adversity, overprotective or controlling parents, reinforced avoidance behavior are key factors. Child adversity is basically any trauma और चीजें जो तुम चाइल्डहुड में फेस करते हो. Child adversity does not just change your personality, but it alters your brain chemistry. There is a phenomenon known as synaptic pruning, which is basically a concept of use it or lose it, जिसमें देखा जाता है कि people who are from healthy homes have healthy neurological pathways, उनका healthy habits सीखी होती है, unlike people or kids from a traumatic household. क्योंकि जब तुम्हारी brain ये healthy coping mechanisms use नहीं करता, तो over time your brain gets rid of them. Overprotective या controlling parenting makes you more prone to a fear-driven coping mechanism, जिसकी वजह से तुम नई चीजें experiences लेते ही नहीं. Which brings us to the next reinforced avoidance behavior. विच इज बेसिकली तुम्हें कोई सिचुएशन में अगर एंजाइटी हो रही है तो योर ब्रेन इज लाइक ये हम अवॉइड कर देते हैं. अगर तुम्हें सोशल सिचुएशंस में या फिर तुम्हें स्पीकिंग में प्रॉब्लम हो रही है और तुम पार्टिसिपेट नहीं करो तो यू गेट क्या कहते हैं इंस्टेंट रिलीफ. और ओवर टाइम योर ब्रेन गेट्स यूज्ड टू इट कि ऐसे हमें एंजाइटी हटा देनी. और इससे तुम कोपिंग सीख ही नहीं पाते हो, जिससे यू आर मोर प्रोन टू गेटिंग एंशियस किसी भी न्यू सिचुएशन में. जेनेटिकली अराउंड 1/3 ऑफ जीएडी रिस्क इज जेनेटिक, स्पेशली ओवरलैपिंग विद न्यूरोटिसिज्म और अदर मूड डिसऑर्डर्स लाइक डिप्रेशन. डिफरेंशियल डायग्नोसिस इज कौन से दूसरे डिसऑर्डर्स जिनमें हम लोग कंफ्यूज कर सकते हैं और मिसडाइग्नोज होने के चांसेस होते हैं. यू विल सी इसमें बहुत सारे अदर एंजाइटी डिसऑर्डर्स आते हैं बिकॉज जो हमारे बेसिक सिम्टम्स होते हैं इनको डायग्नोज करने के लिए दे आर वेरी ओवरलैपिंग. एंजाइटी डिसऑर्डर लाइक सोशल एंजाइटी डिसऑर्डर, पैनिक डिसऑर्डर, सेपरेशन एंजाइटी डिसऑर्डर, इन लोगों के सिम्टम्स आर सेम बट जो फियर का मेजर रीजन है जो उसकी कोर है दैट इज डिफरेंट. फियर ड्रिवन बिहेवियर जो एंजाइटी इंड्यूस होती है दैट इज वेरी डिफरेंट देन जीएडी. अदर डिफरेंशियल डायग्नोसिस आर लाइक एंजाइटी डिसऑर्डर ड्यू टू अनदर मेडिकल कंडीशन एंड सब्सटेंस मेडिकेशन इंड्यूस एंजाइटी डिसऑर्डर जो हम इसके बाद पढ़ेंगे. Except that, obsessive compulsive disorder, PTSD, adjustment issues, depression, bipolar and psychotic disorders, इनके symptoms भी बहुत overlapping होते हैं, which leads to misdiagnosis. Functional consequences: GAD impairs your speed and efficiency at home and work. It drains your time, energy, affects sleep, focus, and emotional regulation. Even as a normal person, जब तुम किसी चीज के बारे में overthink करते हो, you have issues with sleeping and focusing. अगर तुम्हारे दिमाग में कोई एक चीज चल रही है और तुम पढ़ने की कोशिश करो तो you won't be able to study. Now just make it 10 folds for people with GAD because उनको constantly anxiety होती है हर aspect of life के बारे में, which results in low productivity, high healthcare use और heart health risk. GAD is linked to 110 million disability days annually in the US. It causes moderate to serious disability even without comorbid disorders. Comorbidity: GAD is frequently comorbid with other anxiety and unipolar depressive disorders क्योंकि इनके symptoms बहुत ज़्यादा same होते हैं. Shared traits include negative affectivity, neuroticism, and emotional instability. Comorbidity arises from overlapping genetic, temperamental, and environmental factors. Like we have studied in the past 2 days, anxiety disorders में हमने अपने जितने भी पढ़े उनके temperament, environmental factors और genetic बहुत ज़्यादा similar हैं. There is a overlap जिसकी वजह से comorbidity rates are very high. Less commonly, it is comorbid with substance use, psychotic conduct, neurodevelopmental and neurocognitive disorders. Independent comorbidity pathways are also that is all इस topic के लिए. If anyone has any questions, go ahead, Manat.
Differential diagnosis और comorbidity में difference क्या होता है?
Differential diagnosis is basically तुम्हारे जो disorder हम लोग देख रहे हैं वो और किस disorder के साथ confuse हो सकता है. Like misdiagnose हो रहा है कि तुम्हें कोई और separation anxiety है but तुमने GAD कर लिया क्योंकि तुमने ध्यान से देखा नहीं कि anxiety किस reason की वजह से हो रही है. Comorbidity is कि अगर तुम्हें एक disorder है तो दूसरे disorders भी होंगे.
Yes, got it.
Cool. So we'll move on to the next topic.
Well, okay. So today we're going to finish off with the last two topics. Jisme tumhara, they're pretty much smaller than the previous ones because these aren't more defined. Let's just start off with certain circumstances that can happen, which is substance/medication-induced anxiety disorder. अब इसका simple सा फंडा ये है कि whenever you have anxiety as a feeling, as a sort of nature, by nature, it's supposed to exist in the human body. It's supposed to make you feel more alert, feel more open to survival, feel more heightened. But in many instances, when it starts ruining your life, your social interactions, then it becomes a disorder. Now, medication that specifically spikes the brain or neuroreceptors in certain instances can actually induce such instances. Okay, dekho, when it comes to substance-induced substance-induced anxiety disorder, there are three main types. The first type, you could say, the criteria, that is that when it comes to the anxiety disorder, it must be from an instance where you're able to diagnose an individual separately from any sort of outward previously known symptoms. Okay, So, for example, in many instances, many of these anxiety disorders, they have very prolonged period of time. Now, with this prolonged period of time, you must understand that if, for example, someone takes a medication and they have had no history of any sort of like family issue with anxiety, but they start feeling it, then by extension, an individual or a psychologist could see that this person has such medication that is causing them anxiety. This is not just medication; it could also be for any other substances. The other one is that you have been given medication, and because of that, you're getting some sort of feelings of anxiety. In India, because यहाँ पे कोई regulation नहीं है for psychiatrists, so every psychiatrist can just give you medication off the bat. I have had friends who got like medication from a psychiatrist, which is illegal by the way. In like under the United Nations, it's illegal to do that. But India में since कोई legal proceeding है ही नहीं इसके लिए, तो तुम कर सकते हो. So my friend was given it, and because it was meant to like help her with the depression, it backfired miserably and started giving her massive levels of panic attacks, which is based on anxiety. So such instances are very common and can very much happen. Because the case I just told you was very easy to diagnose, but in some instances it could also be that you don't notice it at the beginning, but then over time notice kar sakte ho tum. Last wala is more related to the withdrawal symptoms of how when you start losing a certain medication, you can actually start feeling withdrawal symptoms that could cause anxiety. Of course, again, this also would mean that the medication should have already caused you anxiety, but it's really dependent. The first two are the main ways you can primarily get anxiety in these cases. Now, a simple question I would like to ask the entire like room: what is the one drug that is the most common when it comes to anxiety? Like, कौन सा वो एक drug है, कौन सा चीज है जो सबसे ज़्यादा anxiety cause करती है दुनिया में? It's a certain drug that everyone almost has. I see one hand.
Personal relatability, caffeine.
You nailed it. So, on a technicality, now, caffeine is one labeled as a drug because in many medications, caffeine exists. So, because of that, they have labeled it as a new neurotransmission drug which affects the central nervous system. And उसी के basis पे क्या हुआ कि anxiety is very much caused with it. Like apparently something related to the central nervous system correlates with the neurotransmitters that cause anxiety. And I think 67% of the world like has this problem. So in such instances, we must understand that caffeine can also be a very big predictor of anxiety. Of course, उसमें लिखा होता है कि usually 400 milligrams से ज़्यादा लेने पे ही होती है, but in many instances, if you already are prone to having some sort of panic attacks or have some sort of anxiety, then you're also more easily able to like be sensitive to caffeine in such instances. So it really just depends. But at the end of the day, caffeine is one of the biggest triggers. Alcohol and cannabis, yeah, cocaine, steroids, inhabitants, and some others also exist, but उसपे dosage का दिक्कत होता है. दूसरा, more importantly, the accessibility. Alcohol and caffeine के बजाय, the others aren't exactly the most accessible easily. And if you look at the DSM gave you an entire ICD list, which arguably you need to look into yourself because ये चीजें एक clinical psychologist ही पढ़ सकता है. ICD-10 has codes for each of its like medication problems. So अगर तुम उसमें देखोगे तभी जाके समझोगे. So we're not going to deal with the proper medication analysis. Now, when it comes to diagnosis, we must understand that it usually takes a month. Usually तुम्हारा 1 month के अंदर देखना पड़ता है. उस month के अंदर the psychologist usually is supposed to like check up on the fact that if someone is having such substance with this, then क्या हो रहा है. Usually alcohol and caffeine का आराम से चल जाता है. बहुत सारे patients actually don't tell about their cannabis or cocaine having uses, and उसमें दिक्कत हो जाती है बाद में. Development, it aligns with the intoxication or withdrawal. Timing is key to diagnosis. Yes. Intoxication would just be if you're having something to calm yourself down, but it backfires, then obviously, yeah. ये सिर्फ medication नहीं, तुम्हारा caffeine पे जाता है, तुम्हारी उसमें जाती है, क्या कहते हैं, alcohol पे. So, of course, that's there. And withdrawal, again, if you lose it, then you're bound to start feeling more anxious without it. Symptoms may appear within minutes to hours or up to a few days after use. This again depends on the substance. Most drugs usually take it for like after a few days, but अल्कोहल के घंटों में होता है एंड कैफीन का मिनट्स में होता है. Duration periods of substances, some resolve quickly while others persist longer. Yes, again, it really depends on the substance. If anxiety continues long after the substance is out of the system, consider re-diagnosis. Because for obvious reasons, if the substance is not being continuously poured down, then obviously the case must be a little bit more different. Next slide, please. Differential diagnosis. As we previously have explained, if you're trying to diagnose something and galti se kuch aur ho jata hai, then this is the biggest cases. So substance intoxication and substance withdrawal. What is the difference between this and जो अभी हम बात कर रहे हैं? Substance induced anxiety और इसके बीच में difference क्या है? कोई बता सकता है? Okay. Soumya?
I can try. Okay. So substance intoxication is when you're still under the effects of the substance, and you can get anxiety due to being under the effects of the substance. And substance withdrawal is when you're addicted or you're using the substance so often that you start to have withdrawal symptoms when you're not having it. Whereas substance induced is when you have consumed or have taken the substances for a period of time, and thus even after you have overcome the effects of the substance, you're having anxiety. This is purely a guess.
Nah, you're almost there. Basically, there's no major difference with this one, but I felt like it should still be asked. यहाँ पे substance intoxication ये बोल रहा है कि if you're basically intoxicated with like alcohol or something, or if you took cocaine, then by extension you might feel symptoms or show symptoms that are similar to anxiety, but they're not. यहाँ पे substance withdrawal is the same, where you lose something and then you start feeling very anxious, but that's not still induced anxiety disorder. The primary difference with that is that induced wale mein, the diagnosis must be done by a clinical psychologist, and more importantly, when you look into it, usually the substances are already diagnosed. Like पहले से कुछ जो substance होते हैं, उनका पहले से ही listing होती है कि इससे कुछ ना कुछ होगा तुम्हारा. उसके ऊपर से again, the time period also makes sense. With substance intoxication, usually it gets over after your initial period. Like the anxiety effect gets out. Withdrawal का anxiety से बढ़ के फिर aggression या violence हो जाती है. Again, induced वाले में aggression violence ज़्यादा नहीं होती, aggression violence कम होता है. उसमें तुम्हारा anxiety होती है कि you want something back, but you're not sane enough to actually fight for it. That's how it works. Independent anxiety disorder. So basically, if someone is having substance लेके कुछ भी हो रहा है, but उसके साथ साथ ना main तुम्हारा कोई दूसरा anxiety disorder. So panic, general agoraphobia, any of the phobias. So anything that's separate from that, if that is happening and you just happen to be taking any sort of substances, then that's the case in this one. Anxiety disorder due to another medical condition. This is what we're going to talk about next. But basically, depression, OCD, another one was there. Yeah, any sort of, let's say, neurodevelopmental disorder, these also can contribute to anxiety disorder due to another medical condition. Finally, I would like to ask you, okay, Manat has raised a hand. Ask.
I still did not understand the difference between substance-induced and intoxication.
Basically, this is a differential diagnosis. So when you're trying to diagnose someone outside of the main thing, और उसमें गलती से हो जाती है, then this is the case. Substance intoxication, एक तो उसका time period थोड़ा सा गलत different होता है. Usually after taking a substance and you're feeling anxious for it, you should be able to get off it. Okay. Substance withdrawal में aggression भी आ जाती है तुम्हारी. Aggression and violence भी होता है, which induced anxiety वाले scene में ज़्यादा नहीं होता है, but not to the level that happens in इसमें normal substance withdrawal में. जैसे if you had drugs and उसके बाद after those drugs you're feeling angry that you want some back, then that comes under this. Of course, anxiety-like symptoms might occur in both of them, but at the end of the day, unless you're being diagnosed by a clinical psychologist, you cannot call it any sort of substance-induced disorder. Okay, तो ऐसा scene भी हो जाती है. And finally, last question, is delirium a thing? What is delirium? Okay, Manat, ask away.
Yeah, so I think that comes under neurodevelopmental disorders only. वो F0 category में organic including symptomatic disorders वाले उसमें delirium and amnesia वगैरह उसी की category में आता है. मेरे को बस इतना पता है कि वो F0 category में आता है और वो neurodevelopmental disorder है.
Why, thank you for the definition. Okay, Soumya, please.
I think it's like a state of like mental confusion and like I'm missing another word that I had. I think like it's a state of like mental confusion.
You're almost there. You're almost there. Okay. Anyways, Priyanka.
It's a severe disturbance in attention, awareness, or cognition. Sorry.
Basically, your consciousness is being messed with, an altered state of consciousness that causes confusion. On the most basic level, you feel like your mind is in a fog, where you don't understand why you're taking a decision. Some have described it as being on anesthetics. Some described it as being on anesthetics. Delirium may, its correlation with anxiety is that you're confused to such a point that you might feel or might see anxiety-based symptoms, but they're not enough to call it anxiety disorder. So that's pretty much it. Yes, this is the other one. Anxiety disorder due to another medical condition. Before that, I want to see, do you guys have any questions before to the other ones? Okay, Lakshmi asked a question about independent anxiety disorder. एक बार वापस स्लाइड पे जा सकते हैं. Independent anxiety disorder, basically, na. So, like we've already been studied social anxiety disorder, and then agoraphobia, any sort of phobia, generalized anxiety disorder, all of these, they all have certain criteria of a few months and then a few diagnostic testing. इन सबको exist करने के लिए कुछ कुछ ऐसी चीजें चाहिए होता है. So these all are actual like cases जहाँ पे a clinical psychologist could not be like the patient could also just not tell them कि मैं drugs ले रहा हूँ all, and then वो लोग उसको diagnose कर देंगे ऐसे ही दूसरे वाले main anxiety disorders के साथ. So this is where it comes in the differential diagnosis. Okay, that's pretty much it. Got it, Lakshmi? Okay, next slide, please. All right, anxiety disorder due to another medical condition. So basically, like the previous ones I've just talked about, इसका scene है कि you're basically having a correlation in the mind, sorry, in the brain when it comes to a couple of disorders. Okay, and due to that, instances can be seen where you start seeing such symptoms of 2 or 3 mix up or just go together. Okay, a number of medical conditions can like manifest as anxiety or with anxiety. अब यहाँ पे क्या है कि for to diagnose someone with another medical condition and have anxiety with it, you need to obviously have a history, physical examination, and have any findings or disturbances in the body looked at. Usually, यहाँ हमारे यहाँ पे उतना नहीं करते, but in many other countries, they actually have physical testing as well, even if you're going to a psychologist, like just to be sure if there's nothing else existent. Okay, and primarily speaking, in the cases of another medical condition, it doesn't have to be strictly mental. It could also have like physiological symptoms, where like asthma, hyper asthma, blood conditions, heart conditions, any sort of things like that. That can also be a part of this. Okay, so when it comes to diagnosis, like obviously one of the biggest one is that any other sort of like mental disorder, mental psychological disorder also gets a part of it. Okay? So depression always comes with anxiety, and that's primarily because the neurotransmitters that affect depression can sometimes also affect anxiety. उसका भी scene थोड़ा सा अलग होता है. Like sometimes if it's a little too low, then depression होती है. But if it's a little too high, then anxiety होती है, because the constant rush and fear. So such instances exist. The other one is that, of course, if you look at someone's physical and his like physical examination and laboratory findings, you might see instances where another physiological criteria could be explained for their anxiety. Okay, so if anxiety symptoms occur, but someone is having a like lung disease or some sort of breathing problem, then they either can simultaneously help each other or one or the two are being accidentally diagnosed. ठीक है? This is how it usually goes. In some cases, it could also be that some sort of incident is not being able to be explained properly. Like in some cases where uh, if you don't have a proper idea what's going on with socially, occupationally, or any other important areas of functioning, then in many instances, psychologists are just flabbergasted. There's like a whole portion in this DSM if you don't know where it's coming from. यहाँ पे. And फिर you have to do a careful assessment of multiple factors usually when it comes to such instances, like the age, the symptoms, and trying to check if there's another like physiological mechanism that's happening. ठीक है? That's usually how to do it when it comes to checking up on these cases. Next slide, please. Now, of course, the development in this case, you don't have a certain like criteria of development. It usually just goes with the other disorders like time span. So, for example, if it's like another anxiety disorder, another like mental disorder, usually a couple of months is enough. If it's a physiological one, then it could take it much shorter time, like 1 month or even a few like 2 to 3 weeks. उस केस में भी ऐसे चलता है, ठीक है? This diagnosis does not include primary anxiety disorders arising due to chronic mental illnesses. Again, if it's like some sort of phobia coming out with some sort of depression, then that's not considered under this. This like entire classification only comes when it's like a very normal basis of anxiety that's increased. Nothing out of the ordinary, like special cases where panic hota hai, socially hota hai, phobia hota hai, nothing like that. Okay. And the anxiety is a direct result of a medical condition, not just from stress of managing it. Again, physiological ka bahut scene hai isme. Next, please. Differential diagnosis. Yes. So again, because anxiety can also exist from other disorders, those disorders could also be like looked into. ठीक है? So delirium and major or mild neurocognitive disorders, they're basically any sort of neurocognitive disorder. Neurocognitive disorders basically like cause any sort of damage or any sort of problem in the brain. I honestly am not remembering right now concept of neurocognitive disorder, but anything that usually causes any sort of cognition, mental functioning difficulties, that's usually a neurocognitive disorder. And यहाँ पे वही है कि if you confuse it with the other two, then it mixes up. A mixed presentation of symptoms. So like if it's mood and anxiety, तो वही है कि it's anxiety with another mental condition. So depression already comes out in a part of this. इसमें substance abuse का भी दिक्कत हो सकती है कि some people might see that okay ये coffee ज़्यादा ले रहे हैं, alcohol ज़्यादा ले रहे हैं, maybe that could also be the reason. So that again could also be there. Illness anxiety disorder is a very interesting concept here because illness anxiety disorder just means that it's a somatic symptom one. इसमें तुम्हें डर लगता है कि some sort of other disorder is going to happen to you. So because of that fear, that anxiety existing, you start feeling anxious, and that anxiousness like correlates to a fear that is practically non-existent. So that's like a very interesting phenomena. And then last में जाके adjustment disorder होता है. Does anyone have an idea what an adjustment disorder is? Okay, one hand raised.
I think it comes under the category of PTSD only.
PTSD. Oh, wait, before that, Soumya also raised her hand. Soumya, tu bol.
Manat was apt, but it comes under trauma and stressor-related disorders and not PTSD. It comes under the same group, of course. It is like when there's I wouldn't use the word bizarre, but like a very big reaction, like mental reaction towards like an event that happens in life that causes like a good amount of stress.
Interesting.
Yeah.
So the base principle of it is that in social, it's a behavioral aspect to begin with. Because of this, what happens is a person has to adjust in society. In society, there are certain behaviors you cannot do. Now, if you start doing very maladaptive behaviors or start acting weird or start doing like start doing things that are not appropriate to the general public, then that could come under an adjustment disorder. A very big factor definitely can be trauma, but it does not necessarily come under trauma. Trauma ke under, like, you don't usually see adjustment. Adjustment का खुद का ही कुछ section है, but it's like an emotional response case where the behavior determines everything, and behavior is usually maladaptive. But yes, PTSD all obviously can be a big factor. Stress can obviously be a big factor, but other feelings like hopelessness, physical symptoms, or like anxiety, as we're seeing here, can also be a big judger for this. Okay, wait, Soumya, you have a question.
Yeah, I just wanted to correct you. It does come under trauma and stressor related disorders because the basis of it is you have to have faced a traumatic or stress inducing event in your life that you're not able to adjust to, and that is why a behavioral reaction occurs.
To be honest, I can neither confirm nor deny that right now, at
Right.
least. Like, I'll have to just check the DSM Varna, because they go, if it is like a trauma stressor related, sure, that obviously would make sense. ठीक है, I, at least from what I looked into, इसको primarily सब लोग behavioral पे side जाते हैं. वरना if it is a trauma one, then I'll come back to you and मैं बोल दूंगा, ठीक है. Anyways,
Yeah.
someone was asking for, yeah, Nainika was asking for definition of delirium again. Delirium basically is a case state of mental fog where you're having an altered state of consciousness. What is an altered state of consciousness? It basically means that you don't feel like you're in the controls. Like, you're going on with your daily life, but you don't understand why you're doing such things. You don't understand what's happening. You don't understand what's controlling. ठीक है? So that's pretty much where delirium comes from. And anxiety के साथ उसका ये होता है कि whenever you make decisions or whenever you start acting or doing any behavior, then तुम्हारा क्या कहते हैं, anxiety symptoms are very much prominent. So that's pretty much delirium. Did you understand? That's it. Thank you, guys.